Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Integrative Movement Insider. Hope you had a great weekend. Hope your week is off to a great start. Super excited. We just finished up an online conference last weekend. Actually, we have part 2 coming this weekend. And I'm really excited to share with you that although, unfortunately, the Idea World Fitness Convention out in California was canceled in July, they rescheduled it for online. So it's the first annual virtual, I shouldn't say annual, it's the first virtual online summit for Idea World Fitness. I'm super excited and honored and blessed to be joining 29 other presenters. It's a very tight and small event this year online, where the theme of this year's event is to inspire the world to greatness. And I know you do that every single day. Thank you for being part of our community that's out there leading, inspiring, and empowering individuals, because right now, today, there's never been a better time and more important in really the history of our industry, for as long as our industry has been around, to be that positive role model for your clients. So we truly appreciate you allowing us to be part of your journey and all that you do for your clients and your potential clients that you will attract as you start to up-level your skill set, your knowledge, and even the way you communicate your message even more to your clients and as well as your potential clients. So my topic for this year's event is to really help you develop your strategy, your online strategy. But what's cool about this is it's not just for the online strategy, or you can use it not just for the online, in the online environment, but it's the same strategy we use with our clients here in our clinic, and that you can use if you are indeed seeing your clients. However, I want to share this information with you because many of you are asking, have reached out and asked us, how do I assess my clients actively and accurately assess my clients online in the online environment? And we've been doing that very successfully for the last few years. In fact, my wife and I developed the Integrative Movement System, it was very important for us to be able to work with online environment, because I would have clients that would call me up or email me and say, hey, I really like your information, but I can't find someone in my area. Maybe they're in a different country. So we had to get really, really good at doing online assessments and evaluations, as well as being able to deliver real results to our clients. And I want to share you a quick story with you. I have a client right now, I shouldn't say he's not even a client, he's actually a student. I'm just finishing up the motor control class for the Rocky Mountain University Health Sciences, their master's program. And there's a gentleman in their mat that has had a history of low back issues. And we were just finishing up the lower extremity module. We were talking about glutes, psoas, and some of the issues he's having with his left side. That's where he had the numbness and tingling, because what we will often find with our clients is on the side that they on, so if they had numbness, tingling, and even chronic tightness on that side, that's often the time, or I should say, the position or the location of their disc herniation. So it could be central disc herniation or bulging, but usually it's more one-sided and it impacts more one side in your younger population. As your clients get older, they get more central spinal stenosis, it can affect both sides, but in this younger individual, it's been affecting his left side, and he actually had surgery for it several years ago. He's still struggling with chronic tightness and discomfort. Now, one of the things I was sharing with him is the importance of how you do your hip hinge patterns. So the information that we're sharing with you here on Facebook Live is the same information I've been sharing with these students in the master's program. Now, obviously, I need to present more of the scientific evidence and basis for it. However, there's actually not a lot of scientific evidence for a lot of the things we do share. It doesn't mean it doesn't validate what we do. It just sort of illustrates the point that a lot of what you do with your clients is actually above the curve. You're actually ahead of the curve where research is. Research often trails behind what you and I are doing in our clinics, in our facilities, and with our clients, because research has to be very controlled, and it's very hard to control for all the factors that leads to why somebody has issues or doesn't have issues and what they can do about it. So I was sharing with him the concept of the hip, and it's really an important concept because what we found in our clinic, and you probably see this in clients as well, especially as you work with that older population, they don't have a good forward bend. When they bend forward, they kind of look like this. They get sort of stuck, and we blame tight hamstrings, and then we try to have them do things like this and stretch out their hamstrings, and it never ever really works, or it doesn't provide long-term relief. Besides, they feel good maybe when they off your table or off the floor, but it's never long-standing. But one of the things I've been really stressing with these students and that we teach in our certification program, the Integrative Movement Specialist Certification Program, that it's really not about your exercise or your stretch or your myofascial release. Lots of people have great stretches, lots of people have great myofascial release, but not lots of people don't have great strategies, or another way of saying that, they don't have a great system. Our system, the Integrative Movement System, is top notch because we've worked so hard on developing the nuances of this system and how we teach exercise. And the students initially, they're like, you do all this crazy stuff with your head and your rib cage and everything before you do. What's that all about? And you probably see me do that here online as well. Because we operate under the premise of principles. There's 3 specific principles that help guide and dictate optimal and efficient posture and movement habits or strategy. ABCs, the alignment, breathing, control. We all developed them as children. However, life has taken us away from optimal and efficient alignment, breathing, control, and then we compensate. And then we develop those chronic tightnesses, the postural alterations, the joint degeneration, and all these issues that we experience, and we just chalk it up to life, or I'm just getting older, or it's because I'm not doing enough stretching. No, because you've compromised, your client has compromised their alignment, their breathing, and or their control. So when we set up our clients for success, we want to make sure we really reinforce alignment, breathing, control. I'm going to show you a real quick snapshot of the Integrative Movement System. I'm going to go much more in depth during my talk at Ideal World Fitness Conference. So the Integrative Movement System is a 3-phase strategy. First you assess, then you address, then you progress. You assess to discover your client's non-optimal and inefficient posture and movement habits. These are the habits that are leading directly to your client's non-optimal strategies, their tightness, their discomfort, why they just can't perform at the levels they need to or want to. Then in the second phase, the address phase, that's when you use your corrective exercise strategy to help your clients develop optimal and efficient posture and movement habits that they will ultimately take into phase 3, which is the integration phase or the progression phase. With these habits, the more optimal and efficient alignment, breathing, and control into the fundamental movement patterns. So I want to give you a quick snapshot of what that looks like. So first thing we do with our clients is we always do an assessment. And what's great about this assessment is any client can do it with any level, and you can really see this easily in an online environment. So we just have our clients put their feet together. They put their hands upon their pelvis so they can monitor their own pelvic hip rotation. Now, of course, this is not the only assessment we'll do, but it's just a quick and easy one that you can have clients do at any level. We'll have them slowly rotate to one side, stop, come back to the center, and stop. I want their feet to remain on the floor, so I do not want them rolling to the outside of their foot. I don't want them trying to see how far they can go. It's just hands on the hips, rotate, keep both feet flat on the floor. You can even look over your shoulder, range just to see what your full range is. And then compare it to the opposite side. So now same thing. We'll rotate to the other side, and you can see my head will go, but my hips won't go unless I do something like roll my foot or shift my body to get to that left side. So let's do it one more time. Rotate right, come back to center, stop. Always stop in the middle to center yourself, center your client, go left, and again, that's all I got. I could get more if I compensate, but again, we're looking for uncompensated patterning. One more time, right, center, left side more restricted. Now, so that's the assess phase. Now we move into phase 2, the address phase. So we want to use a corrective exercise strategy. So I would feel around, I would check around, do a couple other assessments to see what needs to be myofascial released around this left side. But I want to show you how effective corrective exercise can be when you understand and implement and apply the 3 principles, those ABCs. So the first thing I'm going to do is we use a hip hinge pattern. So we've progressed our client. So we'll do supported hip hinge here with hands on the wall. We'll do a unsupported with hands on hips. Then we'll progress our client to split stance. I'm going to use split stance because it will really help me target the more tight side, the tighter of my 2 sides, my left. So again, we're going to use the same principles. We're always going to set our clients up for success. Align, breathing, control before you start the pattern. Long spine, stack that rib cage above the pelvis to the best of your client's ability. Their hands will be on their pelvis because I really want them to monitor that anterior pelvic rotation because that will help them release that posterior hip, which is a problem with your clients that have chronic tight hips and or those weak glutes. So from here, long spine, and I'm going to step back. I'm going to make sure I'm squared up to my forward leg. I do not want to step back where you see my right butt cheek. I want to stay squared up to where from the side, you can only see my left butt cheek here. Now from here, it's a soft knee, keep that length, and then it's a rotation. The entire thoracopelvic cylinder will rotate over top that forward leg. And as my student Matt asked, he's like, I see that you really try to keep your hip and pelvis over top. When you're using corrective exercise, you truly want to keep your center of mass over top that forward leg, because what we've been taught to do in the industry is shift back like this. And then what you'll see your clients doing is doing exactly what I'm doing here, staying in posterior pelvic rotation and going to lumbar spine flexion, and then they wonder why corrective exercise doesn't work. So we want to, again, align that thoracopelvic cylinder, stack the ribcage over top of the pelvis, keep the hands on the pelvis, step back, but keep the weight primarily on the forward leg, keep the pelvis and hips facing, the pelvis I should say, facing this direction. And then it's a breathe in, breathe out, hinge, and you should feel tremendous amount of stretch and release across that posterior hip. Let me turn around, apologize for the butt in your screen. But what we want to do is make sure that the pelvis stays square to the forward leg, because what you'll see your clients doing from behind is that right there, where they're opening up their hip, that forward hip, they're going into external hip rotation. We want them to stay internally rotated. So they're releasing through the posterior hip complex, all the external rotators. That's how we start to get more internal rotation and more ultimate hip mobility and start to use and load those glutes appropriately. So last time, lengthen, lengthen, stack, square up to the forward leg and foot. Breathe in, breathe out, hinge. Keep the weight over the inside of your foot, that foot tripod, the big toe, small toe, heel. So I'll do one more repetition. So probably I did about 6 total, and then I'll come back up. And now just recheck, because you always want to see, did you make a difference with your corrective exercises? So again, feet together, feet flat on the floor, rotate right, feels about the same. Rotate left, much different, much more range. Again, not equal to right, so had I done a little bit of soft tissue release first, that would have been much better. It would have been more symmetrical side to side. Now, so that's assess. Now we move on to phase 3, which is progress. You need to teach your clients how to get stronger, how to incorporate this information into the fundamental movement patterns. Bending or hinging is one of the fundamental movement patterns that can change your clients' lives. Because when your client learns how to hinge, they learn how to load up their posterior hip complex, they learn how to control most movements, lower body movements, walking, bending, lifting, squatting, lunging, all those functional patterns, stairs, all the patterns that your clients struggle with, especially also the things that lead to knee osteoarthritis, hip osteoarthritis, low back osteoarthritis, and spinal stenosis. This is one of the most important patterns to breathing. So we love the stiff-legged pattern, but again, it's the same concept of what we did with the hip hinge pattern. So again, one of the things about the hip hinge pattern, let me just show you one more thing real quick, is when you do your hip hinge pattern, so for me, that's as far as I can go where I can keep my cylinder, my thoracopelvic cylinder aligned, and keep that anterior pelvic rotation. So if I drop my arms down, that's as low as I can go. I could go lower, but that's all spinal flexion. And that's why deadlifts hurt people's backs and or perpetuate hip mobility issues, low back issues, disc issues, and a lot of the other issues that your clients are experiencing. So you have to check range of motion. You expect range of motion, use that range of motion. So here we go. Long spine, stack that rib cage on top of the pelvis, grab the bar. Set your feet, soften the knees, and then this is that same hinge, same depth as I got before. So it's here, look down. You can look up, but just keep the down and do your hinge. So again, you should feel this again in the posterior hip complex, in the glutes, hamstrings, but in the low back, not in the neck, not in the shoulders, not in the knees. All just levers to the hips and lower extremity. Remember, one of the keys about this pattern in particular, and really about loading the glutes and getting the glutes to be strong and developing weak glutes and alleviating hip tightness and mobility issues, is the eccentric control. The eccentric control that you set up during the hip hinge pattern, and then you developed and progressed during your loaded split stance and or hip hinge type patterns, a stiff-legged deadlift type of pattern. So I hope that explained to you briefly the integrative movement system. Assess to determine your client's current habits that are leading to tightness, discomfort, and or loss of efficiency. Address, use your corrective exercises to help your client develop more optimal posture and movement habits. And then finally, incorporate those new habits into the fundamental movement. That's how you help your clients create short-term as well as long-term changes in their strategy so they can do the things and successfully and safely do them to accomplish their health and fitness goals. And that's how you differentiate yourself from the rest of the industry, attract more individuals that need, want, and pay you for your expertise, and really be the leader that our industry needs. If you want more information, if you want to join us for this first annual, hopefully annual, I keep saying annual, hopefully it's the first annual online virtual conference, check out the link below this video. Also, you can use my code, which is next to or below this video, to save $20 off your enrollment. Check it out. Would love to see you there to help you inspire your community to greatness and to help you, empower you to be that leader in your community. Thanks for watching. If you have any questions, put them next to or below this video. I'll answer all questions at some point today or tomorrow, and I'm here to help you guys. Reach out at any time. Thanks so much. This is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Bye-bye.